Cash Color Cannabis, a high level of conversation on livehip-hopdaily.tv, sponsored by Greenhouse Bliss. And I'm with my special guest, Dr. Felecia Dawson. How you doing, Dr. Dawson?
I'm great. How are you?
I'm doing well. I think I was here the moment you realized YouTube had TV. You know, like I feel honored to be part of that moment. She was amazed. Like, they have TV on YouTube? I was this years old when that happened. This years old, man. Well, thank you for coming on the show. It's been a while, but I'm honored to have you on here discussing your life and how you found cannabis and your thoughts on Georgia and everything.
Thank you.
No problem, man. Well, first of all, let's talk about some basics. How did you find your way into medicine? You know, I know that you were a gynecologist and you had a thriving practice of your own. Like, how did you find yourself there?
Well, my mom is a nurse.
Okay.
And I've always wanted to do something in healthcare. She used to be an emergency room nurse, actually. And I would hear good stories.
Oh, scary.
Hear stories every day. So I was like, I wanted to be everything from a pharmacist to a hospital administrator. And then my mother claims at age 12, I said, well, so Ma, who is the boss at the hospital? She said, the doctor. I said, oh, okay, that's what I'll be then.
So I want to be the boss in the building.
That's not really true, but you know.
Yeah. I was thinking that the doctors don't run the building, do they?
No.
That's Grey's Anatomy stuff. Like they're not. Yeah, you seem like it's TV stuff. Like that's not reality. That's crazy. So you did get into medicine, and your practice was gynecology, correct?
Yes, obstetrics and gynecology. I delivered probably a couple thousand babies, and I stopped delivering in 2008 because I was starting to fall asleep at the wheel.
Ooh, like literally, like somebody's delivering a baby, like you're falling asleep, or just.
I have nodded off when people were pushing. You're like, oh, okay, we still at this, okay, you know. But I'm saying, like, when I'm driving home after the delivery, I'm falling asleep at the wheel, so I had to give it up.
Now, that's a job I did want to do, like, thanks to Heathcliff Huxtable in the Cosby Show. I legitimately wanted to be a gynecologist, even though, an obstetrician, though I didn't fully get what it was. I just thought it would look dope because he was doing it. I didn't understand that you had to push out a whole child, like, multiple times. Like, you did thousands of babies.
Yes.
That's crazy. So what's it like being that person? You know, like watching life come into the world like that?
It is such a blessing and an honor.
Yeah. I
love to see grown men cry when their baby is born. I love baby's breath. It's so, it smells so good. And it's just a happy time in general.
Yeah.
Now, things can get ugly very quickly in obstetrics, but overall, it's a happy feel.
I bet you it could get ugly. You know, like it's you know, life is life. You know, and what you're doing is watching a person become born. Ooh, but I get the chills even thinking about that, like the blood and all the stuff that could come from
Exactly.
it. You feel me?
Bleeding is not a good thing in obstetrics.
No. What were some of your favorite moments of doing that?
One time, because I trained at Grady, was there as a medical student and a resident. A lady came off the elevator, and she delivered on the ground, and I had time. I didn't even have time to put on gloves, and I just delivered the baby with my bare hands, and it was kind of a little scary because that's when AIDS was starting to happen and all those kind of things. But that was probably one of my more exciting times.
I couldn't do it. I used to be a security guard when I was in college, and I used to work at this place called Sitel in Charlotte. They do OnStar, and there was this call center, so there was a lot of women in there, and there was a lot of women who were pregnant. And our job was, if anybody's water broke, we had to run and go help them. And then once the police and ambulance came, I swear to goodness, one job I did not. Anytime that happened, you had to come find me. Like, I do not want to be there when that happens. Like, I used to tell all the pregnant women, like, please do not give birth on my shift. Just pick another shift. Don't do this when I'm here. I'm gonna be here from 3 to 11. After then, leave it on them because I don't want to see that. I want to be part of it. I pass out. I can already see me. I pass out to do that.
Well, that's probably how I feel about heart attacks. Like, on the airplane, it says, "Is there a doctor on board?" Like, if they're not having a baby, don't call me. Get a real doctor.
Oh, that's great. So, but you did have you're a thriving practice, for a long time.
Yeah, 22 years, I think.
That's crazy.
About 22 years, yeah.
Yeah, and you stopped your Women for Women practice in 2016.
That's correct.
And you stopped that for a reason. You wanted to get into cannabis and help and be an activist for cannabis.
It was a combination of two reasons. One was I was getting tired of the business of medicine. I actually love teaching patients how to be healthy and learning and teaching and all that, but the business of medicine is very stressful. This is, I think I've said it before, the most stressful time has ever been in this country to be a physician. And a lot of physicians are shifting careers or retiring early because of government regulation, liability, electronic records. It's just, decreasing reimbursement. It's a lot of stuff. But I was getting tired of the business of medicine. And probably around 2013, I started hearing about cannabis and reading about it. And, in medical school, we're not taught that cannabis has any good associated with this. We're taught that it's a drug. So, I was just fascinated by that and wanted to know more. So I started turning from medicine that way toward medical cannabis and wanted to teach people and advocate for it and those kind of things.
Wow! So you found out about the cannabinoid system like in real time, like a lot of other people did.
Mm-hmm,
Like it wasn't something that was taught at Meharry or.
Oh no.
That's crazy.
No, there's a survey. I think it came out in 2013, 2014, where they surveyed medical schools, and only 13% of the medical schools even mentioned the endocannabinoid system, which is the system in our body that the plant acts with.
Yeah.
So it came after, it was discovered after even I left school, because it was discovered in the 90s, pretty much.
Now, do you feel like we're going to start seeing medical students actually be schooled on the endocannabinoid system?
Eventually. Eventually. The thing about medicine is that it takes about 15 years when something is discovered before it actually gets put into practice in a doctor's office.
Okay.
Like you hear about a scientific article, whatever. It usually takes doctors about 15 years to start doing it.
Okay, so we still actually got some time when it comes to cannabis.
Well, I hope it doesn't take the whole 15 years now.
Me too, because I asked that question because you're seeing law schools now start teaching. Like FAMU has a marijuana law and policy program going on because they want to keep up with what's going on. So I would think that, like we think about Meharry's and we think about some of those medical schools we see in the area. Like why they're not catching up. But I guess it does make sense if it's from that perspective.
Well, yes. And I'm all willing to help teach the medical students. I'm just gonna put it out there. I'm not gonna call no names or no schools, but I'm available.
Okay, so you did find out about the endocannabinoid system and its importance. Can you briefly explain for those who I'm pretty sure are novices who might just be listening to the show, what exactly is the endocannabinoid system and how it affects us?
Well, the endocannabinoid system is present in every mammal, and humans are mammals. And it is a system that we're born with that helps us maintain balance and homeostasis. So it not only keeps us in balance, but it protects us against cancer and autoimmune disease and mental disorders. It really interacts with the plant, but we also make our own cannabinoids. So it's like cannabis has all these cannabinoids, which are biologically active molecules like THC and CBD. Our bodies make some form of cannabinoids as well, but they're a little bit weaker, but they act like those in the plant.
Okay.
And so they help us with, sleeping, moving, walking, helps protect us from pain, those kind of things.
Yeah, something you should have known and you should be taught. And I was thinking when you left your practice, and I'm sure your peers were shocked that you were getting into what I guess was looking like a drug game.
Yes, I would have to say that half of my colleagues were like, "You want to do what?" And it was like saying, "Did we not have enough trouble with crack cocaine? Why are you going to be going after
crack cocaine,
marijuana?" It's like, and then you have the other half that are saying, "Well, that's fascinating. Yeah. Tell me more."
Yeah, well, I'm sure it's still hard because the stigma of cannabis is still surrounding a lot of people,
Yes, I mean, our country, we have very short memories. In this country, physicians used to prescribe medications with cannabis in it. Yeah. Pharmaceutical companies used to make medicines with cannabis in it.
Yeah. Coca-Cola used to have cocaine.
Yeah. So, I think it's a matter of just not knowing the history.
Yeah.
And then the brainwashing of the Nixon administration and before him as well, with the war on drugs and all that.
Yeah. Well, how was it when how hard do you feel like it is fighting for cannabis when the medical field itself is still dominated primarily by big pharma?
That is cannabis's biggest enemy, the pharmaceutical industry.
Yeah.
And until we reform politics and get some of this money out of politics, because you used to think that the NRA I used to think the NRA was the most powerful lobby group. They spent about $5 million in 2017, but the pharmaceutical industry spent about $270 million in 2017. They are the most powerful lobby in this country, followed by the insurance company.
And they kind of go hand in hand, mm-hmm. So they, they're the biggest enemy of cannabis.
Yeah, insurance spends like $170 million.
Okay. Well, you've become a big advocate for MMJ on the local scene. I see you pop up everywhere. Like you're everywhere, and I'm never there. To be completely, I'm dead serious. To be completely honest with you, I have to look on Instagram to come find her sometimes. You know what I mean? Where's Waldo? So you've been at the state capitol, been on the scene to see a lot
yes.
of movement happening from the hemp bill to House Bill HB 324.
Yes.
Yeah. So what are your feelings on some of the changes we're seeing happening in Georgia currently when it comes to hemp and when it comes to patient access, growing, cultivation? Like, how are you feeling about that?
I'm happy that we're getting a glimmer of being up to date, just a glimmer, but it's really just a fraction of what we should be doing. Okay.
And I've heard that criticism.
Yes. Yeah. The hemp bill is a little bit better than it was initially. I want to say they only were going to do like 3 licenses or something like that. And it's now up to 12, I believe.
Congratulations.
So they're at least, because we're trying to get the bill more open to regular people, not just people with millions and millions of dollars. Yeah. I just left a town hall this evening and came here with Dr. Elena Parent. She's the Georgia senator, and
Elena Parent,
and Representative Becky Evans, and we asked about the HOPE Act or House Bill 324, the medical cannabis, because I knew I already passed the House, so I said, well, surely the Senate has already voted on it, and then Senator Parent said, I'm not sure where that bill is. It hasn't even come up in the committee. I was like, what?
And that's why I was laughing.
What?
I wasn't laughing about Elena Parent, but I was laughing because how I saw her looking one time when they was initially when they were having a conversation about the bill. And I was like, I don't think she fully knows what's happening, but she sure is here. And it did entertain me.
I was very surprised to hear that. It's like, are they trying to make it better, or are they just going to let it die?
It's almost like the decrim bill to me, like the way you're explaining it, because when Kwanzaa came and introduced the decrim bill they had in the city, that was a big deal for about 48 hours. Then I'm like, what happened? Are we still doing this? Is it in place? Can somebody explain something to somebody?
It's still in place, but the officer has the discretion of what law he uses. He can use, Georgia state law. He can use Atlanta decrim law, or if he happens to be on a campus, he can use the college campus law.
Nervous, yeah.
So that be careful about that. Don't think that you won't go to jail.
And that's how I feel. Like, I know this passed, but they have explained it none. And I feel like I'm actually even torn about whose fault is that. Is that our fault for not demanding more information, or is it their fault for just saying, we passed it, we good now?
Well, I would have to say that I must give Mayor Bottoms a head nod, because she brought up that point when they were trying to decide it. She did. She said, I don't want a bunch of people to end up in jail because they think that they won't get in trouble, they fire up a joint or whatever. Yeah. So I was like, wow, she did bring up a good point.
Yeah. Well, well, I want to see more conversation, and I think you just brought up a good point about where we're going with the conversation part about it. We need to, I don't want to just keep getting hyped up about bills getting passed. Like, I want to know exactly, not even just what's even written down, like what's the conversation happening afterwards, because there's always going to have to be a day after. Like, we're going to pass this bill and then what? And then what happens the very next day? I want to know these conversations.
Yeah, and the thing about this bill is it doesn't really address social equity. There's a...
You're talking about HB 324?
Yes.
Yeah.
They're going to have an 11-person panel, or at least that was the initial plan, who will help select who gets the licenses. And only 2 of those people are minority. But we're like 40% of the population. So it's not, the numbers are not really adding up. They're also banning people who are felons, with social equity, you really want people to have their records expunged, and they should be able to participate in this field. But the sheriff, let me tell you who runs the Capitol.
Oh, she about to say it. Because I saw. Yo, look, because when I saw a bunch of, go ahead, speak.
It's the pharmaceutical industry, the religious right, and law enforcement.
Them sheriffs got a big part. I saw them right before they did the vote have that press conference of their own, and I was like, that's bold as hell, to be doing, like, making a stance like that. But
Yeah.
I don't know, like, it's just very nerve wracking to me, because I do want to see progress happen. But you're right, you have three big forces standing in front of that, and they're not trying to budge. In order for people to, like you say, have real access as far as felons, you'd have to be able to expunge their record.
Mm-hmm.
To expunge their record, that means you're slapping in the face one of these three people. You know what I'm saying? Dead in the face, and they're not trying to get slapped in the face anymore by
Yeah, I mean, they're very specific. Your dispensary cannot have employees with this kind of a record. I'm like, oh my goodness, y'all are being really specific here.
Yeah. And so it's crazy. But I do feel like it's a start. And with everything that's a start, you feel like there's stuff you can add on. What I'm hoping is that we're going to continue to put the people in office who could actually add on something.
Well, therein lies the problem. The thing that is, to me, the most important piece of legislation that is happening in Georgia is this voting machine situation.
Oh, yeah. If you've been paying attention.
Yes, Kemp has been suppressing the vote in this state his whole 4 years of being in office. Mm-hmm. And he's very intent on the state buying some more machines that are just like the ones we have, except there's a piece of paper with a barcode on it. It's just as easily hacked. There is no paper trail. And they can decide who wins the election, regardless of what you do.
And that's why they fought so hard for him to actually win the governor race. I mean, he's terrible. I had a chance when I was doing grassroots canvassing to actually go to his office. You have to drop off the voter registration forms at his office. And this is before he ran into the losing 40,000 voter forms situation. But I told people, if you went to his office back then and walk in there, it looked like a bomb hit it. Like, there was just papers everywhere. There was no, like, rhyme or reason to anything. And I would think to myself, all right, so I'm dropping off myself personally 1,000 forms right now. There's 5 other organizations right behind me. I don't know if y'all even paying attention to any of this, but I feel like I'm doing something. Come to find out, you lost 40,000, quote unquote, lost 40,000.
Yeah, right.
40,000 voter registration forms. And I also bring this up too. That should have been a fine of $400 per form, because I was part of a group that misplaced 200 forms, and they had to pay a fine of $400 per form for doing that. He didn't have to pay even a fine for that. Wow. Yeah, 40,000 times 400. He didn't even have to pay a fine for that.
Wow. No, so it's.
But he's our governor.
Yeah, so once upon a time, media exposure and lawsuits would kind of keep politicians in line. Now, media doesn't matter. I mean, the whole country, the world was looking at Georgia and how they were suppressing the vote here, but they still got away with it. So only thing I can hang my hat on now is to hope that the lawsuits that are trying to make their way through the court against the state of Georgia will create some change.
Now, if you could add anything to the bill or make any changes yourself, what would it be?
Definitely include home grow, the expungement piece, make sure that the people who get to select who gets the licenses actually reflect the diversity of the state.
Yes.
Make it a requirement that people pour some of these tax funds back into the communities that have been harmed the most by the war on drugs. And those are some of the main things, yeah. And municipalities do not get access to the tax funds unless they are doing right by the law.
Being compliant, basically.
Yeah.
Okay. All right, well, if you're running for office, and that's, I'd vote for you. Have you thought about running for office?
Well, not really, because I don't have the patience for those shenanigans. I would probably want to strangle someone very easily.
Yeah.
I would not. I don't think I have the patience for it.
Well, like I mentioned, you're always at the state capitol. You're always speaking to people about cannabis and being an amazing voice for the community.
Thank you.
Where do you see the community going? Where do you see the community going when it comes to cannabis and it comes to hemp? Like, what do you feel like the future of that in Georgia will be?
Well, I think eventually more people will get access, but we really need any person of color with land we need you to start growing something, because that's part of what they're going to be looking at. Do you grow crops already?
Do you use the property, basically?
Yes.
Okay.
So that we really need to get more black farmers involved with using the resources they have at their fingertips, because hemp is going to be much bigger than cannabis, because you can do so many more things with hemp. As more and more people come online with cannabis, the price of it's going to keep going down, down, down. So hemp is going to be really the moneymaker.
I believe it. You know, I have family who own a lot of property in around here, and I've mentioned that several times.
Mm-hmm.
And not only continue to grow, but you look towards what this could be.
Right.
You know what I mean? Because you talking about something that could a plant that could be used in so many varieties and so many different ways on so many different industries.
Yes. Yeah. Construction, cars, electronics. It's way more than CBD.
Yeah, way more. When what would you want your legacy to be? What would you want to be remembered for as far as legacy?
My whole thing is that people don't understand how much power they have over their health. And to me, my job is to teach you how much power you have over your health. And if I do that, I feel good.
That's amazing. I thank you for coming on the show tonight.
You're welcome. Thank you for having me.
No problem. And that's Cash Color Cannabis, a high level of conversation, live hiphopdaily.tv, sponsored by Greenhouse Bliss.